Hi, my name is Antonia Pontiki. I'm a PhD student in the Department of Biomedical Engineering at King's College London, and I'm working on the patient-specific chest wall reconstruction for cancer patients. And we ran the study with 4 patients so far, 3 of them that had our method of reconstruction and 1 that had a previous method with only a mesh that did not include patient-specific implants. And the patient with the non-patient specific rigid reconstruction actually did not have symmetrical breathing motion, whereas the other 3 had symmetrical breathing motion.